Hello, I'm Allison Ventura, and I'm an associate professor of kinesiology and public health and the associate director of the Center for Health Research at the California Polytechnic State University in San Luis Obispo. On behalf of our authorship team, I'm excited to present to you our findings presented in the manuscript entitled Associations Between Technology Use, Responsive Feeding, and Child Temperament Among Prior Prenatal Intervention Participants. A growing body of research and current guidelines recommend responsive feeding and parenting to promote healthy outcomes for children. Responsive feeding is exemplified by parent-child mealtime interactions, where parents are attuned to their children's needs and cues and respond contingently in ways that are developmentally appropriate. This means that children are fed in environments where they can signal hunger, fullness, and needs for breaks, and their parents are attuned to those signals and respond in ways that support self-regulation, socio-emotional and cognitive growth, and autonomy for children. Of increasing interest and potential concern is the fact that today's parents live in a technologically connected world. Data from the Pew Research Center illustrates that the vast majority of adults own a mobile device. We check these devices frequently, with some data illustrating that we interact with our devices an average of 80 times per day. Previous research illustrates parents of young children report frequent use of their devices in the presence of their children. Therefore, it's possible that technology use during family mealtimes may impact parents' cognitive bandwidth and abilities to engage in responsive feeding. This image we viewed earlier, where the mother is attuned to her child and ready to respond to her child's cues and needs, is replaced by this image, where the parents are engaged with their phones more than their child and missing potential opportunities to respond to their child's cues and have high-quality interactions during their meals. However, it's important to note that although we have some data suggesting direct impacts of parent device use on their sensitivity and responsiveness to their children, there's also data illustrating bidirectional effects. When a parent is stressed and finds their child's behavior to be more challenging, for example, when their child has higher levels of temperamental negative affectivity, they may use their phones as a way to cope. In light of this previous research, the objective of the present study is to look at associations between maternal technology use, responsive feeding, and child temperament during mother-toddler mealtime interactions. Our first study aim was to examine associations between mother's TV and mobile device use during an observed mother-toddler mealtime interaction and mother's responsiveness to child feeding cues. Our second aim was to assess whether dimensions of child temperament, and in particular negative affectivity, was associated with mother's TV and mobile device use. Our sample included 77 mothers who had previously participated in a multi-site lifestyle intervention to reduce excessive gestational weight gain during pregnancy. The intervention was limited to pregnancy, but mother-child dyads were followed until the child was 18 months old. This assessment included observation of a mother-child mealtime interaction, and trained coders rated mothers' responsiveness to their children's fullness cues using the responsiveness to child feeding cues scale. They also rated whether or not the mother used TV or a mobile device during the feeding. Mothers rated their child's temperament using the infant behavior questionnaire, very short form. I'd like to highlight two main findings. First, we found that mothers who used TV and mobile devices during the meal were significantly less responsive to their children's fullness cues, as illustrated in the figure on the left. Second, we also noted that greater maternal reported child negative affectivity predicted greater likelihood of maternal TV and mobile device use during the meal. As illustrated in the figure on the right, there was an almost 5 times greater odds a mother would use TV or mobile devices during the meal if she rated her child to have greater negative affectivity. So, in summary, responsive feeding is widely recognized as an important support for healthy mealtime interactions. The recent trends we've seen in ownership and use of mobile devices may interfere with responsive feeding and parenting. However, these devices may also serve as an important coping mechanism when parents are faced with challenging child behaviors or other sources of parenting stress. Our study adds to the current literature on this topic by illustrating that mothers' use of TV and mobile devices during meals is associated with lower responsiveness to child feeding cues, but also that mothers who perceive their child to have higher levels of negative affectivity are more likely to be using TV and mobile devices during meals. We invite you to read our manuscript to learn more about our findings and conclusions. Thank you.